Health and Life Science, Management and Science University, Malaysia, who will be sharing invaluable knowledge and experience with us shortly. Before we begin our session, let us first pay respect to our nation. Honorable ladies and gentlemen, students and all participants, please rise if you are in a space where you can do so or just sit for the national anthem of Indonesia. Thank you. You may be seated. Next, it is a great honor for us to invite the Dean of the Faculty of Health Science, Universitas Setiabudi, Professor Dr. Marstiawan Susatyo, to deliver welcoming remarks and to officially open this international webinar. To Professor Marstiawan, we respectfully invite you to deliver your welcoming remarks. The screen is yours.
Okay, thank you very much. Assalamualaikum warahmatullahi wabarakatuh. Selamat pagi. Good morning, distinguished guests, participants, and especially an honored invited speaker from Management and Science University, Malaysia. It's my great pleasure on behalf of the Faculty of Health Science, Setiabudi University, to welcome you all to the seminar on medical laboratory technology. The topic of this seminar will be presented by guest lecturer, Associate Professor Dr. Yu Kesang from the Faculty of Health Sciences, MSU, Malaysia. The seminar actually represents one aspect of the collaboration between Setiabudi University and MSU under the MOU that we have had in the session of expert lectures. We initiate the meeting today with the webinar and hoping that in the next near future, we would like to invite you to come to our university or vice versa from our side to visit Malaysia. For your brief information, Dr. Yu, that our faculty has two study programs that are the diplomas level 3 and level 4 of health analyst. The first one has been focusing on the lab examinations for tropical diseases. So this actually in line to the topic that you are delivered today. I hope that the student sitting in this seminar will kindly follow the lecture and could understand clearly the presentation of Dr. Yu entitled Cracking the Code, Laboratory Diagnosis and Vector Control in Dengue and Malaria. Suppose there are difficulties in following the lectures, I suggest that the questions and discussion later maybe also be carried out in Bahasa Indonesia or in Malays. Finally, I would like to extend my sincere gratitude to Dr. Zul Kizan, to all the participants, and of course to the organizing committee, which enable this event possible. So now I declare the seminar officially open. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Professor Marstiawan, for the warm and inspiring remarks. We are grateful for your support and vision in advancing international academic collaboration. So before we proceed to our keynote session, let us first commemorate this special occasion with a group photo. So we kindly ask all participants, including our distinguished speaker, dean, faculty members, students, to turn on your cameras. If possible, please turn on your camera. Our media and IT team will take several screenshots, so please give your best smile. Please open your camera. Okay, I will direct all of us. If you already open your camera, please wait. I will count. Okay. IT, are you ready? Okay. 3, 2, 1, smile and say cheese. Okay, screen 1. Screen 1. Okay. Next, second screen. 3, 2, 1, smile and say cheese. Yes. Big smile, everyone. Okay. Okay, and the last screen, we have 3 screens today. Okay, the last screen, please open your camera. 3, 2, 1, smile and say cheese.
Yes.
Okay. Okay, thank you, everyone. Okay. Okay, and now we will begin our session. It is my great honor to introduce our guest speaker, guest lecturer today. Our guest lecturer today is Associate Professor Dr. Yu Kosin from Management and Science University, Malaysia. Dr. Yu holds a PhD from University Kebangsaan Malaysia, a Master's in Biotechnology and Bachelor's in Biohealth Science from University Malaya, Malaysia. Her impressive research credentials include a Scopus H index of 7 with over 247 citations. Her main research interests are in mosquito vector control, insecticide resistance, marine natural products, and brain synthesized nanoparticles. Dr. Yu has been recognized with multiple awards, including the National Science Fellowship, sponsored by the Ministry of Science and Technology and Innovation Malaysia, Young Woman Psychologist Award, presented by Asian Pacific Psychological Association, and the Best Researcher Award and Best Teaching and Learning presented by Management and Science University, reflecting her dedication to both scientific excellence and academic leadership over 14 years of experience in higher education. Today, Associate Professor Dr. Yu Kosin will be speaking on cracking the code, lab diagnosis, and vector control in dengue and malaria. So without further ado, please join me in welcoming Associate Professor Dr. Yu Kosin. The screen is yours, Dr. Yu.
Thank you, Dr. Rennie, for your kind introduction. And good morning to everyone in Universitas Setia Budi. Okay, I'm so honored to be here today to deliver and to give a sharing with you all in Universitas Setia Budi. So without further ado, then I think I shall start the presentation. Okay. Am I audible? Okay. I think
Yes,
my
we can
can
hear you
everyone see
clearly,
my
and your
slide?
slide is
Yes.
yes. Thank you.
Yes. Thank you. Thank you, Doctor. Okay, so here is my slide, my title, Cracking the Code, Lab Diagnostic and Vector Control in Dengue and also Malaria. Okay, so this is my talk content. Basically, we will start with the content of introduction of dengue and malaria, and then after that we will start with the diagnostic part of the dengue and malaria. Further on, we will talk about the vector control and a bit of the discussion on the future challenges. Okay, let's have a look of this world map and have an idea of the dengue fever infection in year 2021. Okay, so let's have a look of the Southeast Asia here. As you can see, for the darker color, which include like the Indonesia, the Philippines, and also the Vietnam. Okay, so these are the country with a heavier infection of the dengue fever. Next, I'm from Malaysia, so just to share you about of the statistics of dengue fever here in Malaysia. As you can see throughout these 5 years here, dengue fever has increased, okay? And then when it comes to 2021, I guess everyone still remember these very significant years that we have gone through. We have the pandemic of COVID. So at that time, the dengue cases actually dropped a bit. But after that, when everyone can move around again, the dengue cases has a rise again. So these are the statistics from Malaysia. Moving on, let's have a look of the dengue cases of the record in Indonesia. Particularly here is the dengue hemorrhagic fever. As you can see, okay, from year 2018 to year 2023, okay, so similarly, initially we have the increase of the dengue cases, but when we come to 2021, because of the pandemic, the cases actually decreases, and then after that, the cases actually shoot up again, okay, until 2023 here, okay, and then for the fatality cases, okay, so you can see the tiny red boxes here. Yeah, it also increased from year to year. Okay, so we have an idea. Actually, this is a common and serious issue for this country in tropical country. Okay, after learning about the cases in overall in throughout 5 years, so how about throughout the same years in terms of different months, what's the dengue cases in Indonesia here? As you can see, for example, the record from 2024, we notice that there's high cases at the beginning of the month, beginning of the year, from January to May, and then the cases start to decrease throughout the year end. I guess this probably related to the season and the weather. Okay, so during the different season, maybe the cases will shoot up higher. Then how about which city, okay, that have higher dengue cases? Okay, for example, here this piece of information I have derived. It shows that in year 2022, okay, the city of Jabar here, Jatim and Jatim has the higher cases. in terms of the fertility case of dengue, and then the rest is maintain a lower number. Okay, so maybe this map show us a clearer picture. We can see that the north part of Sumatra and also the west part of Jakarta here, the Java Island actually has higher cases. Okay, and then the south part of the Borneo Island also have higher cases. Okay, so we have understand the number of dengue cases in Indonesia and then which city has the higher number of dengue cases. Then we want to find out, as we all know, the dengue actually we have 4 serotypes. Okay, so actually what is the serotype that has higher prevalence? Okay, in Indonesia. And then I have this piece of information from 2020, and it stated actually dengue 4 is it has a higher prevalence. Okay, from this city of Jember from East Java. Okay, so of course this record from year to year it will have a different trend. Okay, for example, in Malaysia, many years ago, dengue 1 and dengue 2 are having higher cases. But recently, we also noticed dengue 3 and dengue 4 start to raising their numbers. Okay, let's look at the symptom of the dengue. Okay, so they have very common symptom of the viral fever, like eye pain, muscle pain, bone pain, joint pain, and also headache. Okay, sometimes some of the cases, some of the patient at the end of the duration, they have rashes on their skin, and then some of them they have nauseated and vomiting symptom. Okay, so basically the transmission of the dengue is the infected infected mosquito bringing the dengue virus, and then when this infected female mosquito bite the person, it will transmit the dengue virus to the person. So after a very short period of incubation, and then the virus will give symptom to the virus will create a symptom on the patient. Okay, so the patient will start to have muscle pain, all body aches, and also high fever. Okay, so like from the basic symptom, from the headache fever until the skin symptom, and then yeah, that is when it further worsen, it will have different internal organ will be affected. Okay, so they will have more severe symptom. Okay, for example, the complication from renal failure. Okay, from neutropenia, and also all type of reducing number in term of the white blood cell, and then low blood pressure, the shock, and also internal hemorrhaging, okay, internal bleeding. Okay, so just now we have talked about the symptom. Okay, so this is the list of symptom. Okay, basically according to the WHO, the dengue actually can divided into 2 main category, which is the common dengue and also the severe dengue. Okay, so basically the common dengue, when you have 2 of the following symptoms here, then you will be labeled as having the common dengue. Okay, but if let's say add on with that, we have more warning sign, then we'll be categorized under the severe dengue. Okay, so for severe dengue, basically you will have the symptom as the severe plasma leakage, okay, the shock, and then fluid accumulation with respiratory distress, and then just now we have mentioned the internal bleeding, and also the involvement of several organ, okay, such as the brain, central nervous system, the heart, and also other organ. Like just now we have also mentioned about the kidney. Okay, so in terms of the liver, then when you do the testing, then you will find out that the reading of AST will be raising up. Okay. Next, let's have a look into in more detail of the WHO classification of dengue infection and dengue hemorrhagic fever. Okay, so as we mentioned just now, the common dengue fever basically we will have at least two of the following symptoms. Okay, and then when we do diagnostic in the laboratory, then we will notice actually there's a decrement of the white blood cell, okay, leukopenia, okay, and then also thrombocytopenia, okay, and then in contrast, there will be raising up of the reading of the hematocrit, okay, hematocrit. So it will raise until 5 to 10%. Okay. If on top of this symptom, the additional symptom such as the plasma leakage, then the patient will be labeled as the grade 1 hemorrhagic fever. Okay. And then of course, there will be a poor reading, a drop of the thrombocytopenia, and also the raise of the hematocrit until more than 20%. Okay, so the category followed by the grade 2, grade 3, and grade 4. Okay, so in grade 2, it will have the simultaneous internal bleeding. In grade 3, it will have the circulatory failure, and then grade 4, it will plus with the shock with the blood pressure and also in terms of the pulse. Okay, so let's move on into the cases of malaria risk. So this is a world map showing you the malaria risk in 2024. Okay, let's have a look of our region here, the Southeast Asia. Okay, as usual, these are the few countries with a higher risk, okay, categorized as the moderate risk here. So as a tropical country, I guess we have a higher risk compared to other country. Okay, and then yeah, I have this piece of information showing you that the malaria incident in 2004 until 2017. Okay, I guess you can have a look. There's several area of Indonesia actually have uh, a higher malaria incident compared to others. Okay, so how about what for malaria? It's caused by the parasite. We call it the Plasmodium. So we have different types of Plasmodium. So this piece of information to show you that which type of Plasmodium actually infected in the several important islands here. As you can see from this piece of information, the Plasmodium falciparum actually has a higher percentage, okay, compared to other Plasmodium such as Plasmodium vivax and Plasmodium mariae and also Plasmodium ovale. Okay, and for your information, Plasmodium falciparum also consider the severe type of agent that cause the symptom of malaria. Okay, so for the malaria symptom, it includes the fever, the chills, weakness, and also other flu-like symptom. So basically, in order to diagnose it, doctor will ask you about your travel history, okay, or your location, okay, so that we can have more idea to confirm whether you have infected by the Plasmodium. Okay, so now we have an overview of the dengue and malaria already, about the symptom and also about the cases of a different region. Now let's move on to the advances in diagnosing dengue and malaria. Okay, before we go into the diagnostic, we need to understand actually the clinical cause of the dengue and also hemorrhagic fever. So for the dengue hemorrhagic fever, actually it has the three main causes. Okay, it starts with the febrile stage, and then the critical stage, and then the recovery stage. So for the febrile stage, actually normally it will take day one, day two, day three, 3 days. Okay, at this stage, your temperature, the patient's body temperature will be raising up. You will have the fever symptom, and then after that, we will feel dehydrated because of the high fever. Okay, if at this time we have the lab diagnostic, the sample will shows the result will shows that the hematocrit will be low, okay, whereas the platelet, okay, later on will be dropping, okay. At this stage, especially the first 3 days, the viral load in our body actually will be very high. Okay, so based on this, if your patient have the result after diagnostic, we can have more confirmation on that. Okay, so this is also an important piece of information when we want to choose the suitable diagnostic method. Okay, okay. Later on, I will talk about that. Okay, let's continue with the critical stage. Critical stage basically will be day 4 and day 5. Okay, then sometimes when uh, the patient will have um, chills, okay, they feel cold again when the body temperature drops. And then at this stage, they will have internal bleeding or shock, the symptom of shock because of the organ impairment at this stage. Okay, so and
Hello, Dr. Yu. Hello. Okay. Hello, Dr. Yu. You're still mute. Can you unmute? Okay. Dr. Yu?
okay, can you hear me
Okay.
now?
Yes, I can hear you. I can
Okay,
hear you.
sorry for the technical issue here. Okay.
It's okay.
Okay. So just now I was saying about the raising of IgM and IgG. Okay. Then we continue with after 5 days. Okay. We basically most
Dr.
of
Yu,
our
hello. Sorry, can
yes.
you share the slide again? Slide. Can you share the slide?
Okay. Give me 1 minute. I think
Because we cannot see your slide here.
okay, I need to share again. Okay.
Yes.
Let me do that. Share again. Okay. Doctor, can you see my screen now?
Okay. Yes, I can see the screen.
Okay. Let me enlarge it.
Okay. Okay, doctor, you can continue.
Okay. Okay, I hope everyone can see my slide and hear my voice. Okay. Okay, so we come to the recovery stage of the dengue fever. Okay, basically starting from day 6 to day 10. Okay, so now, as we mentioned, this is a recovery stage. Then hopefully, by the proper um, treatment, the platelet count will raise up, and then basically, the antibody in our body, IgG, IgM will be raising up. Okay, yeah, that is the clinical course. So let's see what should we do during the different clinical course here. So during day 1, day 2, day 3, which is the febrile stage, okay, when the temperature will be raising up. Okay, the temperature will be raising up, and then at this time, the hematocrit will be very low. Okay, so when we have our full blood count, definitely we will notice the hematocrit, okay, low, but it will raise up, and then the drop of the platelet, okay, the drop of the platelet count, okay, as well as the drop of the white blood count, okay. And then just now we have mentioned about the high viral load, right? So this is a suitable time when we have high viral load in our body. Then when we do the nucleic acid amplification test, okay, it will be more sensitive, okay, for the first 3 days, okay. So this is a time if let's say you want to screen out the serotype of the dengue, either is serotype 1, 2, 3, 4, and then this is a good time that you have your sample and run out this nucleic acid test, RT-PCR. Okay, during the critical and also the recovery stage, okay, the platelet basically will be remaining low, okay, depends on the recovery stage of the patient, okay. If the patient still have severe symptom, their hematocrit will be very high as well. Okay, but let's look at the antibody in the patient. Okay, so we have learned that if this is the first infection of the patient, okay, so we will notice that the patient will have the IgM antibody in their body, okay, after day 3, okay, until 12 weeks. Okay, but if you have checked with the patient not just having IgM but also IgG, then it tells us that this patient actually has a past infection. Okay, so this is not his or her first time having the dengue. Okay, so IgG tell us the past infection of the patient. Okay, so this clinical course with the diagnostic will tell us different information. So by having understanding the clinical course, okay, so we can choose a better diagnostic, and then we will have more information about the infection. Then we will can give a good treatment and also monitor, and soon, hopefully, the patient will recover as soon as possible. Okay, so just nowadays the rapid test is very common. Okay, so by understanding the clinical cause of the dengue, then we will know and understand, okay, basically at what stage you will have what kind of result. Okay, so like just now we mentioned, when at the beginning stage, when the viral load is high, basically it's very sensitive. The kit will be very sensitive into the antigen of NS1. Okay, so this one detect when will be very sensitive when we the first 3 days, okay, when we test on this NS. Okay, whereas when at the later stage, okay, the IgM will show positive, and when we have IgG positive, we will learn that this related to the previous infection. Okay, so of course, when you have positive result of all these testing factor, then maybe you will learn that actually you have a acute secondary infection. Okay, so of course, just now we mentioned if we want to learn about the serotype, okay, we can do the nucleic acid test. Okay, so this is to share with you actually from CDC, they have the guidelines, the essay about how to use the RT-PCR, okay, to diagnose the dengue serotype 1, 2, 3, 4. Okay, let's move to the look into the clinical cause of the malaria. So malaria, we have stage 1, 2, and 3. So basically, for malaria fever, we start with on and off, coldness, shiver, and also fever. Okay. Similarly, we will have fever, vomiting, and also headache. Okay. When it come to stage 3, basically you will feel very tired. Okay, muscle tiredness. Okay, so we have two main groups of the malaria. We have the uncomplicated malaria, basically like the tertiary malaria, which have the fever spikes every 48 hours. And then we have the quantum malaria, which the fever spike every 72 hours, okay, for Plasmodium malariae. And then, yeah, as we have mentioned, for the Plasmodium falciparum, this is the most common and consider the severe type of malaria. So it has the irregular fever spikes, and then while this is labeled as a severe malaria because it will cause the complication of the central nervous system, okay, and also other symptom, okay, such as the bleeding. So let's look into the test and diagnostics of this malaria. Okay, so basically we have the common one, which is the microscopy, and then we have the rapid test, and then further on we will have the nucleic acid testing and also the antigen testing. Okay, so for the microscopy, it's very straightforward. Okay, you need to have a trained technologies to identify, prepare the blood smear, and then to identify the infection. Okay, so the advantage of this blood smear microscopy is very cheap, low cost, and then it's able to carry out in those primary health care facilities, okay, without expenses of or complicated lab setting. The disadvantage is we may have misdiagnosis of the malaria. Okay, maybe when we have repeated testing, then it will can avoid this incident to be happen. And then the low diagnostic efficiency. Okay, so it's kind of laborious to do this, as so far we need the human manpower to prepare the blood smear and then do the checking under the microscopy. Okay, other than that, we can have other lab feature diagnostic to give us the indication of this severe malaria. Okay, we check on the level of hypoglycemia, okay, the anemic level, the red blood cell, and then parasitic parasite load in the blood, okay, and also the kidney function. Okay, so this indication can give us some idea about the level of the infection, okay, of malaria. So again, rapid test is quite common nowadays. So this is the rapid diagnostic test. We call it the flow immunochromatographic assay. So as usual, so we drop the blood sample at the hole and then we run the lateral assay, okay, so to give us whether we have the infection of the parasite or not. Okay, of course, for the research purpose or for the national report, we would want to know what species of the Plasmodium actually cause the malaria. So by having the molecular detection, it will give us the species level of the infection. So this is of course very highly sensitive. And then the setup, actually, we do not need high volume of sample. And then where with low amount of sample, we are able to carry out the test. The disadvantage of this molecular test, of course, very basic. We need to have a well-equipped laboratory and with the budget of running the molecular test. Okay, nowadays, other than the typical PCR, RT-PCR technique, okay, we also have the technique, which is the LAMP technique, the loop-mediated isothermal amplification. Okay, so for this one, the equipment-wise will be easier to prepare, as we can have a maintained temperature when we prepare or amplify the nucleic acid. Okay, and in terms of the presentation of the data, also we can have different choices here. We can actually have the quantification of the real time, or we can have the qualification just to detect through the colorimetric method, or even though we can later on apply on the rapid test and to see the result. Okay, either it's positive or is negative. Okay, so coming to the next part of my talk, I will talk about the vector control strategies. Okay, so this figure shows you the different type of mosquito-borne diseases here. We have mentioned about the dengue fever. So dengue fever, we have mentioned about the symptom, and then yeah, this is the main culprit of the infection of fever. Okay, which is the tiger mosquito. Okay, mainly the primary vector is by this mosquito. We call it the Aedes aegypti, primary vector of the dengue fever. Then we have talked about malaria, and then the symptom. And yeah, this is the mosquito, which is compared to the tiger mosquito, the Anopheles mosquito has a lighter color, and this is actually the species that prefer to live in the area with green vegetation. Okay, the Anopheles mosquito. We call it the malaria mosquito. Okay, how we actually deal with it for mosquito vector control. Okay, in general, we said that we have different approach, of course. we have the chemical approaches, which we using the insecticide, okay, the chemicals, and then through different application, we introduce this insecticide to our target, which is the mosquito. Okay, we can do a large approach, a large spacious approach like the space spraying. And then if come to residue spraying, then this is a more targeted application when we go to house and then to do the spraying. Okay. And impregnation, okay, this is more related to how we impregnate the insecticide to the bed net, and then we distribute this bed net to the high risk village people and the larvae seeding. Okay, so we distribute this insecticide commonly in powder form to the breeding site. Okay, basically the water source. Okay, to kill the larva, mosquito larva. And then we have this biological approach. Okay, so nowadays many plants, many natural product resources has been proven to have the possibility or activity to kill the mosquito. Okay, so that is the natural product based insecticide. For another approach, basically this is a more innovative approach, which they sterile the mosquito. So when this group of mosquito release to the field, and then they could not produce the next generation. Okay, so that is a sterile insect. And then genetic modified mosquito. So using the GE technique, they modified the mosquito, the gene of the mosquito. So this mosquito, their offspring, they will not able to survive in the environment. Okay, in that way, we reduce the population of the mosquito. And then that is also related to the competitive displacement. Okay. And at the end, of course, there's no one silver bullet for the issue here. Okay. We, from time to time, according to the situation, okay, we will need to incorporate more approach, more techniques, and then we will need to monitor what's the effect of each technique and also updated our data in order to plan a better approach for the next step. Okay, so for the chemical control, so here we have the pesticide application. For the space spraying, okay, commonly we call it the fogging. Okay, for household application, we have the aerosol spray for the insecticide. The aerosol spray basically are the insecticide that we can buy from our supermarket. So the residue spraying, okay, residue spraying, basically this one is when the authorities, okay, they will carry this knapsack, okay, and then they do spraying. Okay, for the case of malaria, yeah, we do have this officer, okay, having carrying the knapsack and then go to house and do the spraying. Okay, the indoor spraying of the villages. Impregnation, okay, there's dipping and also spraying on material. So dipping here commonly refer to dipping the insecticide, dipping the bed net into the insecticide. And then after that, we air dry the bed net and then we distribute this bed net to the villagers. So this bed net which carrying the insecticide, okay, they will serve as a protection to the person that sleep under the bed net. Okay, so when the mosquito come, the physical barrier of the bed net, okay, guards save the patient, okay, the villagers. And then when the mosquito contact with the bed net, then they will bring the insecticide. Okay, the insecticide will serve control or kill the mosquito. Larviciding. So this one direct application. Okay, we disperse the larvicide into the water source and then we kill the mosquito larva. Yeah, this is just now what we mentioned about the indoor residue application. So the officer here will have the tank that carrying the insecticide. So they will do the indoor spraying, okay, of the villages, the house of the villager, okay. And then the picture on the right here actually shows the monitoring test, okay, of the effectiveness of this insecticide. Okay, so of course we need to monitor the effectiveness of the insecticide in order um, to learn about the duration of the effectiveness. And then when we found that it's no longer effective, then the second round of spraying can be carried out again. So far, last time, 10 years ago, okay, we do use DDT, but nowadays we are more focusing on using this pyrethroid as the insecticide for spraying. This is the impregnation, okay, of the insecticide treated net. So yeah, the workers will help to soak the bed net in the insecticide and then they air dry it and then they will distribute to the villagers. So when they rest under the net, they will protect themselves from the biting of the malaria mosquito. At the same time, if the mosquito come and rest on this net, they will bring this insecticide with them, and different insecticide will give different effect to the mosquito. Okay, some will be contact poison. So contact poison meaning to say once you have the contact, then they will give the toxic effect to the adult mosquito. Some they will serve as a growth inhibitor. Okay, so they bring this insecticide to their breeding site. Okay, so the growth inhibitor will inhibit the growth of the mosquito larva. So the mosquito larva couldn't develop to adult, and then in that way we reduce the mosquito population. Okay, larvicide, okay, normally we will use the thermophos, okay? So there's different application. As you can see, some of the application is spraying, okay? They will disperse the insecticide to the water source, so they will kill the mosquito larva in the water source. Okay, of course, we want to reduce the population of the mosquito larva. And then on another hand, actually, when we come across and we check on our environment, okay, we do some modification and we do some manipulation of our environmental setting, okay, that will also help us in terms of controlling the population of the mosquito. For example, here, for the Anopheles mosquito, normally they like to lay eggs on the calm water, stagnant water. Okay, so if let's say you can build something like here to generate the water movement of the lake, okay, so from the stagnant water it turned into a moving water, so the mosquito won't prefer to lay eggs there. Okay, in that way we reduce the egg layings of the female, okay, on the certain site. Okay, so same as here, we do a device so that we keep agitating the water in the pool, Okay, so from stagnant water become a moving water. So in that way, we reduce the possibility of the mosquito laying eggs there. And in urban area, our main issue is the blockage of the drainage. Okay, so if let's say we can always have a flowing drainage, a clear drainage from the rubbish, then it will improve as well. Okay, when we reduce the breeding site of the mosquito. Okay, next, let's talk about the biological control. Okay, so there's many innovative approach in terms of the biological control here. One of the advancement here is to use the bacteria, okay, to kill the mosquito larva. So this is a natural product approach, using natural product to control the mosquito population. This bacteria is a natural occurring bacteria. Okay, so when we feed it to the mosquito larva, it will become a gut poison, okay, to the mosquito. So it will cause lesion to the midgut of the mosquito, okay, and then the mosquito will die from it. The good things about this, it does not affect the non-target organism. Okay, so this is a good point of it. And then nowadays we also have this program, okay, in Malaysia, in Indonesia, okay, we have this program in Singapore also. We are carrying out they have carried out this program. We call it the World Mosquito Program. So basically, many years ago, we have found out that this bacteria, the Ubachia, okay, so when we introduce this Ubachia to the mosquito, we learned that the mosquito will not able to carry the the dengue virus. Okay, so when the mosquito having this bacteria, they will not able to transmit the dengue virus. Okay, at the same time, this when they produce the offspring, when the mosquito produce the offspring will carry the bacteria. Okay, yeah. So yeah, so when we introduce this infected Ubachia infected mosquito to the community, and then further on we learn that the mosquito will not able to transmit the dengue virus, and then this bacteria will inherit to the offspring of the mosquito. Okay, so how it actually affect the offspring? Okay, we learned that if the male mosquito carrying the Ubachia, when it mate with the female mosquito, so they will not produce any eggs. Okay, so if both of the Ubachia infected mosquito mate, okay, yes, they are able to produce the eggs, and then all their offspring will carry Ubachia. Okay, when the female Ubachia carries the when the female mosquito carry the Ubachia, okay, so when it mate with the male mosquito, the female can produce egg, and then the offspring all will carry Ubachia. Okay, and then again, bear in mind, this population of mosquito carrying Ubachia, they are proven that they will not able to transmit dengue virus. Okay, so this is a picture to show you that for few years in Malaysia, we have carried out this field testing of using the Ubachia control. So you can see that this kits is starting doing the setup of the ovi trap consisting the mosquito egg infected with the Ubachia. Okay, so we want to have this population, okay, to replace the wild population in our area. Okay, so that the to increase the mosquito population with Ubacha, and then this group of mosquito, they will not able to transmit the dengue. Okay. So at beginning, we started at KL, and then after that, we have extended to Putrajaya and even many locations of the Selangor. Okay, so I have mentioned and I have shared a few of the approach in terms of mosquito control. So how about the monitoring procedure or monitoring steps that we can do? So in terms of the Aedes mosquito, when we do survey or field surveillance or sampling, normally these are the device that we can use, okay, and we normally use by our ministry here. So we call it the orbit trap. Okay, so basically this is a black container, and then we will fill in some the water, and then we will have the pedal here. So this serve as the substrate to let the female to lay eggs here. So normally we will set it for 5 days, and then after 5 days we will come and collect this back. Okay, so that we bring back this sampling of mosquito back to the lab and further do our testing and also monitoring. So as you can see the background picture here, it shows the environment in the urban setting. Okay, so in urban settings such as in the city, we are troubled with this Aedes mosquito. So let's have a switch, okay, from the urban setting to this picture. As you can see, this is more to the suburban setting, which is at the outdoor and also in the nature. Okay, so the background you can see these are the stone. These are basically at the waterfall side by the river. Okay, in the estate, in the plantation area. Okay, so in this area, basically, we are more trouble with the Anopheles mosquito. So these are how different technique we will do sampling of the Anopheles mosquito. So for Anopheles mosquito, we are not able to set the trap like what we have done with the Aedes. Okay, we need to have a more active approach to go out and actually look for the Anopheles. So as the picture at the first picture and the middle picture here showing how we actually do getting the sample with the dipping method and also pipetting method to get our mosquito larva of the Anopheles. Okay, at the natural setting site. Okay, from the water pool, okay, ground pool, and also beside the holes and cracks between the plants and also the natural setting. Okay, this is another example where how we actively to do sampling, uh, especially for the Anopheles adult mosquito. Okay, so in the last time we do really use this bare leg catch, so human as a bait. Okay, and then we lure the mosquito to come, and then after that we will capture the mosquito. Okay, and then nowadays, of course, with the advancement of technology, we have different light trap. Okay, so we have this light trap bait with the carbon dioxide. Okay, so by releasing this carbon dioxide, the mosquito will come and then they will be captured into the trap here. Okay, so with this, we actually can record using GPS, and then we will have a clearer picture of the location of this mosquito. Okay, especially when we are doing the surveillance. Okay, so for surveillance purpose, okay, in terms of the infected mosquito, okay, so these are some technique we can use in the field. So we captured the adult mosquito and then we dissect the mosquito. So basically, in order to um, confirm whether the mosquito is infected by the parasite or not, basically there's two regions that we can look into, the organ which is the midgut and also the salivary gland. Okay, so for the midgut, we look for these oocysts. So if let's say you can see the small butting uh, on the midgut, then we believe that this mosquito has been infected by the Plasmodium. And then in the salivary gland, then you will see this sporozoid, the tiny worms here, those are the sporozoid. Okay, so by understanding the infestation of this parasite on the vector, the mosquito, then we have a clearer picture of the risk of the people staying nearby getting the disease of malaria. Okay, so we want to control the vector first, okay, so that hopefully the vector will not cause much, it will not bring the disease to the nearby people staying nearby. Okay, of course, other than the microscopy, now we'll talk about the molecular identification. So after that, this organ, okay, we can send to run the PCR test, and then we can learn about the species level of the Plasmodium, okay, in order to know what species is actually affecting the mosquito, bringing the malaria to the human. Okay, so I have talked about and share about a few method and approach in Malaysia, and also some of the approach actually also carried out by other countries. Okay, so just to share with you this piece of information, think about from 1970 until 2015 here. Okay, in Indonesia, what's the approach that Indonesia is using in order to handle the dengue infection? So of course, same as Malaysia, at first, we use larvicide. Okay, we kill the mosquito larva. So we will distribute this powder form of insecticide and then to the water source, and hopefully the mosquito larva die. Okay, and then after that, when we have dengue cases raising up, and then we have identified the hotspot. Okay, well, we also have this fogging activity. Okay, so this picture here showing the workers actually will do the spraying in terms of fog. Okay, during morning time, evening time, dawn and dusk. Okay, to target to the adult mosquito, to kill the adult mosquito. And then, bat net, okay, another common approach, okay, like previously I have mentioned the impregnated bat net that we use, okay, so that um, we advise the people to sleep under the bat net so that to protect themselves, okay, and then at the same time, we clean the water of the container that catching the water in our house so that we destroy the possible breeding site of the mosquito. Okay, and then how to manage the container around your house. Okay, so that this container that um, have the possibility to catch water to be the breeding site of the mosquito, we try to destroy it, okay, or try to reduce the risk of this container become the breeding site. Okay, and then later on, move on, we start to knowing that it's important to educate our community. So we have this combi activity. Okay, so we educate, we have seminar, we have campaign, okay, to educate and hopefully to have to make our community to have a better awareness, okay, better behavior and also good practice when it comes to protecting our family, our friends from having this dengue. Okay, so yeah, these are also similar approach that we have in Malaysia. Okay, come to future challenges. Yeah, as we have mentioned the previous slide, okay, awareness among the community is very important. Okay, so the disease is not responsible of a certain person or is not just the responsible of the government. It's a responsibility of everyone in the community. Okay, from the children to the parents to the adults, everyone will have the responsibility. So if we clean our surrounding and avoid and try to reduce the breeding site, when there's no mosquito, then there will be less dengue cases. Okay, so we hope that the community have this awareness. Okay, so we will try to reduce, okay, the breeding site and then the population of mosquito, and then the virus will not able to affect the human, okay, when the vector is not available. Okay, for malaria, the same approach, yeah. How to protect our loved ones, okay. We have the bed net, okay, the spraying methods, and also nowadays we do have uh, the the drugs, okay, especially for the pregnant woman. And then for the dengue, also nowadays we do have the vaccine, okay, in order to protect us from getting the infection. So, yeah, the study of mosquito, we have done that, okay, how to kill the mosquito by the chemical approach, by the biological approach, we have done that. And then contact the surveillance, what's the technique in the field to collect the sample, we have done that. And then at the last part, how to educate to the member, to the community, and together how we respond to our uh, res- respond to our call, okay, in order to terminate the transmission of dengue. Okay, so that one we also have covered it. So this is a fight of everyone in the community to kill the mosquito, okay, that bringing the malaria, that bringing the dengue. Okay, so I will end my presentation with my contact here. So if anyone interested for further communication or collaboration, you are feel free to contact me. Okay, so I hope that there will be an opportunity for us to have further discussion and also a research opportunity. And if in any way I can help, I would be honored to do so. Okay, with that, my last slide. Thank you for everyone for your time, and hopefully one day I can see you in your university, or you can also welcome to come to MSU, come to Malaysia to join us here. Okay, to meet us here. Thank you, everyone.
Okay, thank you very much, Dr. Yu, for such an insightful and informative presentation. I believe our student and all participants, including faculty here, gain insight from this lecture. And thank you for the invitation to coming to MSU, and you're also welcome to our university in the near future, hopefully. Yes. Actually, last 2 weeks, I was at MSU, but we didn't get the chance to meet in face. So sorry for that.
Yeah. Yeah, thank you, doctor, for coming, and I hope you enjoy the short trip in MSU, and hopefully in the future you can come for more days, longer period.
Yeah, we plan for that. So, yeah, for your information, our university is located at Central Java. From the map, the chart that you presented, it's number 2 highest in that chart, Central Java. And also, some of our students here are from malaria endemic area, which is labeled in red in your previous map figure, I believe. So that's why we set our program vision in our diploma program to focusing on the tropical disease examination. We hope that our students gain greater awareness about the importance of laboratory diagnosis and vector control in combating dengue and malaria. So they are better equipped to face these challenges and contribute according to their roles as a future medical laboratory technician. And now we are opening the floor for Q&A session to all participants. If you have any question, you may type them in the Zoom chat, or you can use raise hand feature and ask directly. We will try to accommodate as many questions as time allows, and there will be special prize to those who give the best question. There are 6 prizes, and also there are more prizes to those who answer post-test correctly and quickly. So keep your question coming to our expert lecturer today. I believe some student already asked question. Okay.
Yes, doctor.
Yes, from Damar Yudhistira from diploma program. Okay, Damar asking about any biomarkers being researched that can help predict severity of dengue or malaria.
Okay.
Would you like to answer directly,
Thank.
or we go to the question?
Yeah,
Oh,
we can. I can just brief.
okay.
Okay. Thank you,
Yes.
Dharma, for your question. Biomarker. This is a very good question. Yeah. Like for example, in the case of cancer and also other diseases, we do have the biomarker. But when it comes to these infectious diseases, that's the thing that maybe we lack of looking into it about biomarkers, because when it comes to infectious diseases, especially in this case, mosquito-borne diseases, which is the parasite infection and also virus infection, it actually involves many different aspects of the body. Okay, so to my knowledge, I'm not very sure what particular biomarker which can give the direct indication of the dengue and malaria, because virus infection is something quite difficult to deal, as when the virus come into our body, it actually can affect many organs of our human body. So if I have any further information on that, then I can share more. Okay. So far, to my knowledge, maybe um, like other diseases like cardio cancer, that have more study on the biomarker in that way. Okay, hopefully I give some information on that question.
Okay, thank you, Dr. Yu, for answering the first question about biomarker. Yes, it will be future challenge, I guess, for more research about this. And if Damar would like to study more about this, you can continue your education to MSU and study with Dr. Yu. Next question coming from Danu. Danu would like to ask about what are the latest advancement in laboratory diagnosis for dengue and malaria. because personally, I would like to know and uncover what new technologies or methods are being used today, especially in Malaysia, that improve the accuracy, speed, or affordability of diagnosis as a laboratory technologies. Okay.
Okay, thank you, Danu, for your question. For this diagnostic, basically, like what I have shared in my slides, there's two different level we are talking about the diagnostic. Okay, so the preliminary diagnostic in terms of the treatment, okay, whether you got the disease and then what is next. So that one, nowadays, many clinic in Malaysia, we use the rapid test, okay, rapid test kit. So that's why I'm sharing that one. So that is fast. Okay, accuracy sometimes depends on the kits, can be up to 95% of accuracy. So so in few minutes you can know the result, and then that helps in terms of treatment uh of the doctor, okay, in our primary healthcare facilities. Okay, so that is one direction. In another direction, talking about diagnostic in terms of a more research-based approach, when we want to go into a molecular level, for dengue is the serotype, and then for malaria is the species level. Then of course we need to have a molecular technique such as RT-PCR, LAMP, and so on. Okay, so basically this is depending on your objective and also the nature of the lab. Okay, whether you are a basic diagnostic lab or a research-based lab, so you will have different approach. Okay, so yeah, if let's say in the future you are working in the common diagnostic health lab, then maybe the basic rapid test, that antigen test, it will be good enough. But you, if let's say you are working with the ministry and then the research lab in the university, then you will may need some molecular technique, okay, to find out more ideas about the infection. So yeah, that is basically the different approach and also different purpose of the different diagnostic lab.
Okay, thank you. We go to the next question about dual endemicity of dengue and malaria. What are the diagnostic challenges arising from overlapping clinical symptoms, coupled with the limited sensitivity and specificity of RDTs? And what are the implications for integrated vector control strategies, especially given the limited laboratory resources and the issue of vector resistant to insecticide in tropical regions?
Okay, let me have a good look. From
From
Ardiva, okay,
Ardepa, yes.
yeah, Adiva, basically she is asking, I think, two parts of the question. The first part is the diagnostic challenges. Okay, so yeah, for rapid test diagnostic, of course, depends on the quality. Okay, most of them, I guess, in the market or approved by the ministry should have 95% and above of the accuracy. Okay, so in terms of the use of getting the result in short time, okay, serving to the community, okay, that would be good enough for the application. Okay, but of course, in terms of treatment, um, most of the time we are dealing with the symptom like fever, okay, and then symptom of dropping the tablets. Okay, so for this one, basically, we are just handling the symptom. So yeah, for that part, I guess in order to handle the symptom, as long as we have the correct approach, should be okay. Um, if you are talking about overlapping, okay, so first we do the rapid test, okay. So if let's say positive, then we straight away to handle the symptom. And then if after 1 week for dengue, if after 1 week you still remain high fever, then maybe we would need to reconsider of other possibility of other infection. So I guess based on the symptom, then the doctor may need to request for other diagnostic in that way. So that is the general comment from me about the overlapping clinical symptom, because it's very hard to discuss in general. It need to be a case by case approach. For the second part of the question, implication of what are the implication? Okay, implication of the integrated vector control. Yeah, of course, there are so many strategy around, but it always come back to the main question, which what is the problem of the community facing? Okay, so for us who are staying in the city, of course, our situation will be different from those who are staying at the suburban area, or those who are staying at the near the jungle fringe. Okay, so we need to really understand the situation, then only we can do different approach. Okay, because yeah, like the case for malaria definitely will be different for the case of dengue. Okay, even the case of dengue, when we are in the area of high-rise building, like in Malaysia, in KL, in Selangor, we have a lot of condominium. Okay, so that area, the way to approach the area with a lot of high-rise building like condominium will be definitely different from when we are controlling those area um, uh, with uh, with landed building. Okay, like in Malaysia, we have the city and then we have the villages, the kampong. Okay, so in the kampong, we have those house which dedicated house with their own yard, own garden. So the approach will be definitely different. Okay, so as an officer, if let's say you come across to propose the strategy, you need to really know the setting of the place and then the behavior of the community. Then only you can propose a suitable strategy. So as we can see, yeah, Singapore with many high rise, their mosquito control strategy is different from Malaysia. Okay, and when you compare to Indonesia, which having so many islands, okay, it's also very different. Like Philippines, also many islands. So yeah, this is the authority needs to understand the setting of the area. Then only we can propose a better strategy for the area. It is not like one and only package. It can be a different combination of different method. Then we propose as a comprehensive plan to the area. Yeah. And then, yeah, there's a third part about the vector resistance. Yeah, this is also one part of my research which I'm doing now, but I didn't really share in my slide. I'm doing the mosquito insecticide resistant. Okay, typically Aedes albopictus in Selangor area. Okay, so yeah, this caused a concern to us because we noticed that previously a certain district of Selangor, we do have agriculture activity. When agriculture activity, they use insecticide. Okay, and then this insecticide eventually also affect our mosquito, okay, population. And then we noticed that certain area with the agriculture activity, their mosquito also have more resistant to some particular insecticide. Okay, even though the mosquito is not related to the agriculture, but somehow it get infected. So resistant status of the vector actually is also one of the concern of us in tropical region. Okay, thank you for the question.
Thank you, Dr. Lee. Next question about vector control from Winda. I believe this question already answered before, right, Dr. Yu?
Yeah.
From the previous question. I think it's also input for this question. Next question about from Faris. Other methods that are more effective than rapid IgG/IgM for detecting dengue fever.
Okay,
Asking about the
so
methods.
when we talk about effective, okay, so what is your concern about effectiveness here? If you are talking about to be very sensitive and specific, okay, until you want to know about the serotype of the dengue virus, then of course it would be the molecular technique. But when you are talking about budget, okay, more cost effective, okay, so that's why they are using this rapid test of antibody. Okay, rapid test using the antibody. Okay, so that's why it's basically how you define effectiveness. Yeah. If you are at the primary healthcare sector, you talk about budget and cost effective. But if let's say your approach is for the research and specific city level, then of course we want to use the molecular technique. Okay, so that is the different thing. When we have different objective there, then we may affect us in terms of choosing the best method. Yeah.
Okay, we move to the next question from Diana asking about how can labs in low resource setting improve diagnostic accuracy for dengue and malaria? Asking about low resource setting laboratory.
Okay, I guess like we just now we have mentioned about the rapid test. Okay, that is cheaper, and then cheaper in terms of it has less requirement of the lab setting, and also a less requirement in terms of the qualification of the manpower. Okay, and if you want to improve your diagnostic accuracy, then the next level maybe you can go for serotype equipment that give you to target the serology test. Yeah, that will be less expensive when we come before we come to the molecular test. Yeah, that I think that is another approach if you have limited budget, but you still want to improve your accuracy of diagnostic. Okay, so before you go to molecular test, maybe you can aim for some antigen or serology tests.
Yeah, because molecular tests are expensive for low resource setting laboratory. Primary health, we have a lot of RT-PCR equipment from COVID previously, but they don't have other resource to do the test. So this is the current problem in Indonesia.
Yeah.
Okay. And
Oh.
next question is about dengue fever from Karin, asking about this is maybe just curiosity question, asking about, is it possible for tropical disease occur in non-tropical countries? So that's the question.
Okay, thank you, Karen, for your question. Just to share my experience with you, I have once been to China. As you know, China is a big country, and then the south part of the China actually is warmer, and then the north part of the China is the temperature is lower, right? So at the warmer part, which is the south part of the country, they do have dengue cases. Okay, so at first they started with imported cases, imported dengue cases to China through the south part of the country. Of course, this is because of the advancement of the technology and movement of people worldwide. So they start to introduce these dengue cases to south part of the country. And then slowly, then they have more dengue cases moving up to the north part. Okay, so maybe 10 years, 20 years ago, you won't have much mosquito in Japan, in China, which is those are the non-tropical countries. But now, due to the transportation, the advancement of technology, and then global warming, our mosquito also start to travel slowly to those from tropical country to the non-tropical country. Yeah, so that is a possibility. It's happening now. So yes, at first, of course, it's through the imported cases, but when the cases go into the area and then it start to spread through the transportation.
Okay, continue to the next question. It's related to the previous question. Asking about Chris Mudita, asking about role of climate change what role does climate change play in the changing patterns of dengue and malaria?
Yeah, generally when the temperature raising up, it shorten the incubation time or the larva stage of the mosquito. So when the temperature is higher, then the larva stage will be shorter, and then they will take a shorter time to emerge into adult. Okay, so we will have the adult mosquito faster during the warmer season. Okay, so that's the challenge. And one thing bear in mind for the mosquito egg, so they need the water source to emerge into larva. Okay, but this mosquito egg, when there are no water source, when they are in a dry situation, it can stand for 6 months to 1 year. Okay, so imagine now they are dry for 6 months, and then after 6 months, after 8 months, suddenly there's a water source that contact to this mosquito egg, they still can hatch. Okay, so imagine the advancement of transportation. So there's a shipment from Malaysia, from Indonesia to China. Okay, it takes 1 month to go to China maybe, but after 1 month, when they reach China, maybe other countries, then they have the water source, so the eggs can still hatch. Okay, so that's the challenges that we have in dealing with this very, very stubborn and very strong-willing creature.
Okay, continue to the next question from Jessica. Jessica asking, maybe Jessica has experience about malaria. She's asking about why Plasmodium falciparum infection are more likely to cause acute kidney injury compared to other Plasmodium species. Probably she has experience or maybe her relative has the experience because she's coming from the endemic area of malaria.
Okay, so for the malaria case, yeah, we have learned that falciparum actually have a more severe symptom causing comparing to the other species. Okay, this is I think because of the reaction of this parasite in the body. Okay, actually, because it causes frequent fever spike. Okay, so these changes of temperature in the body basically will cause a lot of reaction from our internal organ. So hence it cause the organ dysfunction. Okay, when organ dysfunction, especially for the brain, for the kidney, then it will uh, bring more symptoms, severe symptom for the infection. Yeah. It also replicates faster if compared to other species of the Plasmodium. Okay, I think
Okay.
that's all. Yeah.
Okay, we have the last two questions from Andreno. Andreno asking about maybe this is a problem in Indonesia about misinformation or resistance in the community regarding certain vector control methods. For example, fumigation and the use of larva-eating fish. So how can we address problem misinformation or resistance in the community? So this is about the community or the people.
Okay, like in Malaysia, when we want to implement a new approach or some strategy, definitely we need to communicate with the community, okay, to have seminar and workshop, okay, to educate the community first, okay, to have a discussion with the community first before we actually implement it. uh, real experience in our Malaysia, when we want to introduce the Ubaca program. Okay, so the basic of the implementation of the Ubaca is actually releasing the mosquito in the community. So imagine when we need to release thousands of mosquito with Ubaca in the community. Okay, so definitely a community will be very anxious when they see so much of um, mosquito being released. Okay, so that's why this is nature. By nature, we will be worried about this. So before that, before we actually execute the field trial, we do need to communicate with the uh, community. We have talk, we post it in the media, we have news article, okay, we do survey among the community, and then we have our leader, okay, to walk into the community, to hand by hand guide the community how to give cooperation and how to assist us to carry out this program. And then when there's after release, of course, we need to monitor and then we need to follow up. And then the community really can notice the changes when after we have implement the Ubaca mosquito. Okay, the dengue cases really drop. Then we also feedback to the community about the success rate of the activity. Okay, so this community slowly accept the program, and also in fact the leader of the community help us to carry out the program when we want to move to another neighborhood. Okay, so they will tell their friends, they will tell their family, okay, so our region, our kampong is having this Ubachia mosquito and it's giving good result, and then now your community is trying, so don't worry. So we will help you, and then we will share you the information how to do it. Okay, so education and awareness is very important because um, like I said, this is not single person's responsibility. Everyone need to take parts and everyone play a role. And when everyone is playing her or his role, then definitely we can meet the objective that we want to have. Yeah. So this is through awareness activity through the seminar.
Okay, thank you, Dr. Yu. Next question from Alfitra. He's asking about vaccine. Is there any possibility vaccine for dengue? Is it possible? Asking about vaccine for dengue and malaria, I believe.
Yeah. There is dengue vaccine in the market now. Okay. So in the Malaysia case, for the government so far to date, government is not distributing to Malaysian free. Okay, but they are aiming to have that program started for the children. Okay, for the high risk group, which is the children and elderly. Okay, they are planning to start with that. Okay, but if for Malaysian, if we want to buy the vaccine and administrate it, we can do it in certain clinic. Okay, just that we need to pay it, and then for the brand that we have available in Malaysia, we actually need to have 2 doses to have the complete vaccine. Okay. So that is, yes, already available in the market. And in Southeast Asia, I guess the brand that we are having, I think are the same brand. I guess. So clinical trial have done. Yeah, it's available in the market.
Okay, thank you, Dr. Yu. I believe in Indonesia we also have that program.
Yeah.
Last question from our faculty member. He is asking about, is it possible that a blood donor transmitted dengue from one person to another? Can it happen?
Okay. Okay, so far I think no. For the transmission for dengue virus, I guess no. Okay, but for yeah, for other cases, there might be the possibility.
Maybe taking example from HIV, right? Is it
Yeah.
possible HIV transmission from blood donation or blood transfusion? But for dengue and malaria, there's no report for that, right? I believe. Okay. Okay, this is the last question, and I have one question for me regarding the research, because I'm also a researcher. So from your perspective as a researcher also, what area in regarding dengue and malaria that in diagnostic and vector control that need urgent attention?
Urgent attention, I guess, when the dengue cases has raised again after COVID, even though dengue cases basically affected many people in the population. And if let's say we don't take good care of the dengue cases, it can proceed to hemorrhagic fever. So I guess in this case, awareness is very important. Okay, so that when we have the awareness, then whenever we have the vector control will be more effective. Okay, so if we do not have the awareness among ourselves, one thing is we won't seek for treatment. So it will prolong to the severe stage easily. And another thing, if we are not aware of it, we will tend to increase the risk by providing a lot of mosquito breeding site. And after that, when the mosquito population get higher and higher, that is definitely increase the risk of us getting the disease. So I guess this is a whole comprehensive approach, not just in terms of diagnostic, but also the vector control, but also the cooperation from the community. So in everyone need to contribute themselves in order to really bring down the cases. I hope I
Thank you,
answer
Dr.
to
Yu.
you, doctor.
Sorry?
I hope I answer your question.
Oh, yes. Maybe the last, can you give advice to our student? Maybe some advice or concluding remarks for them?
Okay, yeah, most of you are in the class or in the program for diagnostic. Yeah, that is what I understand. Okay, so please bear in mind all the techniques or all the skill that have you learned. Okay, not just will be beneficial in the diagnostic area, but somehow when you further on to pursue a higher qualification, okay, maybe you also have the opportunity to move into research, to move into developing new innovative methodology or new product, uh, and that also will be beneficial to the community. Okay, so I wish you all the best. Okay, so and hopefully from the diagnostic lab, okay, when you have the opportunity, you can step out and also do more things to benefit back to your community. Okay, so that is my best wishes to you all.
Okay. Thank you once again, Dr. Yu, for answering all of the questions with such clarity. I believe we have all gained valuable insight from your expertise. As we draw this enriching session to a close, allow me to reflect briefly on what we have learned today. Through today's lecture, we have gained deeper insight into how early and accurate laboratory diagnostic paired with integrated vector surveillance and control strategies can significantly improve our fight against the world's most pressing mosquito-borne disease, dengue and malaria. Our guest lecturer today reminded us that cracking the code is not only about the tools or high-tech diagnostic, it's also about collaboration across disciplines and empowering communities through education and prevention. On behalf of the organizing committee and Universitas Setiabudi, we extend our appreciation to Associate Professor Dr. Yu Kesin for generously sharing her expertise, research finding, and passion for tropical disease control and public health. To honor and express our gratitude, we would like to present a certificate of appreciation to our distinguished speaker. So please help IT and media to present the certificate. So this certificate is awarded to Dr. Yu Kesin for her outstanding contribution as guest lecturer today in international webinar. Thank you once again, Dr. Yu, and please give Dr. Yu love emoji from your Zoom. Give her because we cannot give applause here, right? Just yeah, just sending emoji. Okay, thank you, Dr. Yu, once again.
Thank
Okay.
you.
So before we officially close today's webinar, we would like to remind all participants, especially our student attendees, that to receive your e-certificate, you are required to fill out the attendance form, evaluation form, and complete the post-test. The link will be shared in the Zoom chat or will be sent via WhatsApp group after the session. Please complete all today by 12 this afternoon. If you have any issue accessing the form, feel free to reach out to the committee. We appreciate your active participation and we hope the certificate will be a valuable addition to your academic journey. To all students and participants, we have now come to the end of our international webinar. We hope this session has sparked your curiosity, broadened your understanding, and perhaps even inspired future research or innovation in the field of medical laboratory science and global health. On behalf of the organizing committee, we would like to express our sincere gratitude to Associate Professor Dr. Yu Kusin for the enlightening session, the Dean of Faculty of Health Science, Universitas Setiabudi, for the warm welcome, and most importantly, to the webinar committee, all participants, students, and faculty who made time to join this meaningful session. May today's session serve as inspiration for all of us to continue innovating and improving healthcare through medical laboratory science. Let us continue building bridges through science, collaboration, and education. Thank you and see you at our next academic event. Have a great day, everyone, and thank you for joining us today. Good afternoon, everyone. Thank you, Dr. Yu. See you again, Dr. Yu.